take it to the Himalayas and chant so that I could get a wish from Lord Shiva to transform my whole body into a woman.
So I actually want to know about your journey uh, when you were admitted, when you got up on the next day of the surgery, when I did your first dressing and removed the stent and did the dilatation. I think we could achieve 7.5 inch with the soft silicone dilator. And the day you got discharged. These three are the milestone days of my.
Absolutely.
So, what was your experience about all those days?
If you remember, so I had come for the X-ray just right beside, and I was hoping like strongly for a 6 hour surgery because there were fears about there were a lot of fears like with holding up with 12 hour surgery for me at this age and with a lot of past histories of COVID and smoking
You
histories
are
and all the other
young.
thing.
Don't say
So
this
basically,
age.
like I was a bit fearful.
Okay.
So, but eventually, it ended up to 12 hours. I'll be very honest with you. I wasn't thinking about myself, but I was thinking about you guys. Because in a row, 12 hours on a surgery table,
Yeah.
handling complex things
Yeah.
in order to give me a better life was something really overwhelming. I'll be
Thank
very
you.
honest, the first thought when Dr. Renu woke me up, Riya, the surgery is done. Okay, we are leaving for now. You'll be dressed up and you'll be shifted to your ward. The very first thing that came to my mind was, oh my god, what's the time right now? And I asked her the time and she told me what the time was. And I was like, oh my god, you guys have been here since 10 a.m. in the morning and you're just leaving back to your families. I was just going and resting on the bed, mellowing in the bed perhaps, because I'm already sleepy and I'll be just sleeping down. So it's like something really remarkable that you doctors are doing. Whereas
Thank
if you
you.
consider my experience, I went to the bed, I was all awake. There was O2 pipe inserted inside my nose and the cup, and everything. I went down to sleep. I knew it very well. I was told that I won't be able to get up by myself, and I wasn't allowed to drink water, which was the worst part, to be very honest.
Yeah.
I wasn't allowed to drink water for 24 hours.
Yeah.
And I was thirsty as hell.
Yeah.
Because I had stopped drinking a night before.
I
And
do
hence
understand
it
that.
was like my throat was killing me. And I'm
Yeah.
a person who needs water every 5 minutes.
Oh.
So that's the thing. That was the only part that actually was a bit, choppy for me. And then again, when I think next evening you came down and you just told me to start the clear fluids.
Yep.
And get rid of the O2, which was really the greatest day. It really made me feel happy.
How was the pain, Riya?
Pain initially it wasn't there. I was actually hoping for a lot of pain because a lot of my friends who have undergone the surgery have told me a lot of stories which I now disbelieve because they told me about the tremendous pain the very right from the moment they were shifted to the ward. Okay. Until for 3 days. Okay. Later. But I experienced no pain except for the pain in my back because of lying in the same position.
Okay. Okay. But
So
that depends from patient. I mean,
depends upon the patient, individuals, yeah.
individuals. Yeah.
I understand. But the pain started rising after 4 days.
Yeah.
In the vaginal cavity.
Yeah.
Also in the stitched area.
Okay.
Basically.
Okay.
And I'll be very honest, the moment you removed the stent,
Yeah.
I shook hands with God and came back, at that moment. It was like, the pain was like terrifying.
Okay.
It was, I do now realize like the pain was more psychological than
The actual pain.
the actual pain because I
Yeah.
was hell lot fearful. I was, since being a non doctor, I'm not aware of what the things are inside and how delicate they are. Like, I live in a world outside the body where, like if thing falls down on the floor, it breaks.
Yeah.
If we apply a lot of pressure on something, it breaks. So that was the fear, to be very honest. Like.
So at the same time, your body was not ready, or it's not ready because it's the first experience you got after 40 years of your life. So tissues, they have their own memories. They are not, the cavity has been created in the area where there was nothing, or it was all muscles there. So that fear, that pain, we can understand that. Yeah.
There.
And what was the emotions when you left the nursing home and when you reached to your home? How did you enter your home?
One good thing that I would say, I was really curious to actually see my vagina because You did show me a picture, while I was in the OT bed, but I was half unconscious, so I could not actually have a great look on my, the thing that I've been waiting all my life. There is an instance which I have already shared, but I would really want to share on the camera, like how people like me feel, that journey, how it starts. Like, I belong to the era where, in 1999, I got my first computer for my dad as a gift. It was more like to help him with his business. We had a dial-up connection, and the only search engine then was Alta Vista, which we were aware of. And ever since I have been looking, searching online for a month or something, wherein I could take it to the Himalayas and chant so that I could get a wish from Lord Shiva to transform my whole body into a woman, and a very beautiful woman. I knew it wasn't actually possible because all these are mythologies and good to read as stories or something like that, but they would never really happen. God has different ways to deliver it to them. And I found a very wonderful way. This, you are the way, the God has delivered it to me.
No,
And eventually, when I got it, I was like, finally,
yeah.
finally, it's, I'm complete now.
Super.
I'm
super.
complete
These
woman
are-
now.
Yeah. Thank you. Thank you. I mean, I don't take the credit on me. I think if it would not have been me, it would be someone else who was a GRS surgeon. The idea is like you wished for it and you got it either through me or through some other surgeon. There's a different story, but I'm really happy that you could achieve which you wanted since long.
Absolutely.
Nice. So coming back to today, today is day 14. The journey is almost ending. You have done the recovery and everything well.
True.
Today we are going to put a stent inside, which is a soft silicone stent,
Okay.
and that is going to prevent the vagina to collapse. Now this is again a customized stent which we are creating,
Okay.
and we have achieved 7 inches of depth. The stent has a little tongue coming out, so you can pull it out, dilate yourself again and put the stent inside. You can roam around with the stent. You can do all your routine with the stent. The stent will avoid the cavity to collapse. It is as simple or a basic principle of plastic surgery as if in a bone contracture I remove the contracture and straighten the finger.
Okay.
If I don't apply the splint, the memory of the finger will bring it back to its original shape.
Okay.
So I want to splint it for at least 3 months to 4 months and start the physiotherapy.
Okay.
The same principle we apply when we create a cavity, that we want to stent it so that the surrounding structure again doesn't collapse the cavity,
Okay.
and we can maintain the cavity. Once the tissue changes the memory after 3 months, 4 months, 5 months, then the period for which the stent stays inside goes on a decreasing side or decreasing
Okay.
time. But if you keep the stent inside, you're going to have a long and a persistent cavity for longer duration.
Understood.
So let's start that process now. If you
Sure.
want to speak
Definitely.
something to the audience, it's all yours.
I just want to say, be yourself. And when you are on a path which is different than the path the world is expecting out there, of course, there are going to be a lot of difficult situations. There are going to be a lot of fears. It's you who have to fight with those fears and the difficult situations. And eventually, let me tell you one thing, it's going to be a very bright and sunny day. So just
Nice.
be yourself.
Nice. Be yourself. Thank you.